Hi there, thanks for tuning in. In today's video, I'm going to discuss about burns, burn management, nursing interventions, and the rule of nines. And after the discussion, I have a 2-item quiz that you need to answer. So break a leg, guys. Now let's get started. A burn is a tissue damage caused by excessive heat, electricity, radioactivity, or corrosive chemicals that denature or break down the proteins in the skin cells. All burns cause homeostatic imbalances in the body and are graded according to their severity. A nurse who cares for a patient with burn injury should be knowledgeable about the physiologic changes that occur after a burn, as well as assessment skills to detect the subtle changes in the patient's condition. Burns are classified according to the depth of tissue destruction as superficial, superficial partial thickness, deep partial thickness, and full thickness. Common appearance for superficial, it's only dry, red, easily blanching, sometimes painful, such as a sunburn. For superficial partial thickness, the epidermis is destroyed or injured, and a portion of the dermis may be injured. For deep partial thickness, a deep partial thickness burn involves the destruction of the epidermis and upper layers of the dermis and injury to the deeper portions of the dermis. A full thickness burn involves total destruction of the epidermis and dermis, and in some cases, the destruction of the underlying tissue, muscle, and bone. So these are the types of the depth of a burn. So the common appearance for superficial, again, they're dry, red, easily blanching, sometimes painful, such as a sunburn. For superficial partial thickness, it's moist, red, blanching, blisters, and very painful. So remember that the layers of your skin, it's epidermis, dermis, then your fat or subcutaneous, muscle, fascia, and then bone. For deep partial thickness, it's drier, more pale, less blanching, and less pain. Why less pain? Because some of the nerve endings have been affected, so you feel less pain. Compared to superficial partial thickness, only the epidermis and some parts of the dermis is affected, so you feel pain because the nerve endings are still there. For your full thickness, it's dry, leathery texture, variable color. It could be white, brown, or black. Loss of pink prick sensation. The burn is black and leads to loss of the burnt part, and the injury to deeper tissues include your muscle, tendons, or bone. For the calculation of TBSA, your TBSA stands for total body surface area. For your superficial, it's not counted. For your superficial partial thickness, it's counted. Deep partial thickness, it's counted, including your full thickness. How do you calculate the TBSA? By using the rule of nines. The rule of nines is used to estimate the total burn surface area. So the rule of nines is different from an adult and for infants and young children. Your total body surface area, or your TBSA, is an assessment of injury to or disease of the skin, such as burns or psoriasis. In adults, the rule of nines can be used to determine the total percentage of area burned for each major section of the body. That's both for adults and children. Let's proceed to the clinical manifestations of burns. The changes that occur in burns include the following. A person that is burned, especially for your full thickness or deep partial thickness, will experience hypovolemia, decreased cardiac output, hyponatremia, hyperkalemia, and hypothermia. Why hypovolemia? This is the immediate consequence of fluid loss and results in decreased perfusion and oxygen delivery. Decreased cardiac output decreases before any significant change in blood volume is evident. Also, there's edema. Edema forms rapidly after burn injury. Decreased circulating blood volume. Circulating blood volume decreases dramatically during burn shock. There is hyponatremia or decreased sodium. Hyponatremia is common during the first week of the acute phase as water shifts from the interstitial space to the vascular space. Hyperkalemia immediately after burn injury results from massive cell destruction. And there's hypothermia. Loss of skin results in ability to regulate body temperature. Again, further explanation for hypovolemia. It is the most profound and direct effect of a burn. It is primarily due to a shift in protein and fluid from the intravascular to the interstitial space caused by an increase in capillary permeability. Hypovolemia results in burn shock. Let's proceed to your rule of nines for your adult. The size of a burn can be quickly estimated by using the rule of nines. This method divides the body surface area into percentages. The front and back of the head and neck equal 9% of the body surface area. I'm talking about an adult TBSA. I repeat, the front and back of the head and neck equal 9% of the body's surface area. The front and back of each arm and hand equal 9% of the body's surface area. The chest equals 9% and the stomach equals 9% of the body's surface area. The upper back equals 9% and the lower back equals 9% of the body's surface area. The front and back of each leg and foot equal 18% of the body's surface area, and the genital area equals 1% of the body's surface area. Let's proceed to children. So the rule of nines for infants and young children. The size of a burn for a baby or a young child can be quickly estimated by using the rule of nines. This method divides a baby's body surface area into percentages. The front and back of the head and neck are 21% of the body surface area. The front and back of each arm and hand are 10% of the body surface area. The chest and stomach are 13% of the body surface area. The back is 13% of the body surface area. The buttocks and the genital area are 6% of the body surface area. And the front and back of each leg and foot are 13.5% of the body surface area. That is the rule of nines that is used to estimate the total burn surface area for young infants and children. When a patient has burns, what do you think is the best or the preferred IV fluid for resuscitation of fluids? The best IV fluid to use for burn resuscitation is your lactated ringers, your LR. It is the most frequently used crystalloid solution for burn shock resuscitation. Normal saline was used in the past but has been criticized primarily because it may decrease the renal blood flow and glomerular filtration rate, thus increasing the risk of acute kidney injury, and in large volumes it may cause hyperchlomeric metabolic acidosis. So let's proceed to the nursing interventions for burn care. You have to monitor for hypothermia, hypovolemia. You assess the breathing, maintain cervical spine because we need to prevent further injury of the cervical spine, and we conduct neuro evaluation. We can use our Glasgow Coma Scale for your neuro evaluation. And for your nursing tips, severity of burn injury is determined by location and extent of the burn area. Assess for burns involving face, mouth, or smoke inhalation, stained facial hair, smoke debris around the mouth that may compromise airway and need intubation for airway management. Facilitate transfer to specialized burn unit for extensive burn injuries, genital burns, high voltage and chemical burns, and pediatric burns. Hyperkalemia is likely to occur as a result of cell lysing or destruction. It means that the electrolyte inside the cell is potassium, and when potassium goes into the bloodstream, it can cause hyperkalemia. So I think that wraps up for your burns, for your NCLEX that you need to know. Thank you so much for listening. Have a great day. It's quiz time. I have a 2-item quiz, so let's answer. First one. When assessing a patient who spilled hot oil on the right leg and foot, the nurse notes dry, pale, and hard skin. The patient states that the burn is not painful. What term would the nurse use to document the burn depth? A. First degree skin destruction. B. Full thickness skin destruction. C. Deep partial thickness skin destruction. Or D. Superficial partial thickness skin destruction. I'll give you 1 minute to think of your answer. Time's up. The correct answer is letter B, full thickness skin destruction. With full thickness skin destruction, the appearance is pale and dry or leathery, and the area is painless because of the associated nerve destruction. Erythema, swelling, and blisters point to a deep partial thickness burn. With superficial partial thickness burns, the area is red but no blisters are present. First degree burns exhibit erythema, blanching, and pain. Second item. A patient is admitted to the burn unit with burns to the head, face, and hands. Initially, wheezes are heard, but an hour later the lung sounds are decreased and no wheezes are audible. What action should the nurse take? A. Encourage the patient to cough and auscultate the lungs again. B. Notify the healthcare provider and prepare for endotracheal intubation. C. Document the results and continue to monitor the patient's respiratory rate. Or D. Reposition the patient in high Fowler's position and reassess breath sounds. I'll give you 30 seconds to think of your answer. Good luck. Time's up. The correct answer is letter B. Notify the healthcare provider and prepare for endotracheal intubation. The patient's history and clinical manifestations suggest airway edema, and the healthcare provider should be notified at once so that intubation can be done rapidly. Placing the patient in a more upright position or having the patient cough will not address the problem of airway edema. Continuing to monitor is inappropriate because immediate action should occur. I hope you got the correct answers, guys, for item number 1 and 2. Thank you so much. You have a great day. That concludes my video for today. Thank you so much for watching. I hope you learn a lot from my videos. Have a great day. See you soon. Bye for now.